Hey everybody, this is Dr. Vince from Functional Therapy and Rehab in Joliet. Today I'm going to talk about a common test performed in the clinic. It's called the lateral step-down test. What this test does is we're looking for movement quality during the test. There's a large percentage of people that will tell you that the test will indicate hip rotation weakness, and that's one of the things that it can look at, but it also looks at a few other things. So I'll do the first test on my right leg, and if you look at, there's a straight line from my hip to my knee to my ankle, okay? And when I step down, what you're looking for is to see, does the knee collapse inward, okay? And so again, I'll do it one more time. And so on my right knee, it collapses inward. And we'll do the same test on my left. And on the left knee, no collapse. Okay, one of the other things that could cause the knee to collapse inward aside from the hip is the ankle. If there's a loss of dorsiflexion, meaning the ability to take your knee over the front of your foot with your knee pointed, roughly second, third toe, then that's called dorsiflexion. And if you look at me on both sides, you'll see I can keep going on my left, but my right stops. Okay? I have a history of an ankle fracture on the right side. Any injury to the ankle could actually cause this dorsiflexion loss. And when you have that loss, it'll show up in other motions, such as a squat, a lunge, a lateral step down. So if I were to spend a majority of my time focusing on hip strength, because that's where one of the assumptions is that this knee buckling in can come from the hip, I would completely miss the actual cause of that knee coming in. And then some small details, I know you can't see it, but when the knee buckles in like that because of a loss of dorsiflexion, it can also start to create a bunion on that same side, because in order for me to get my knee to go forward, here, you'll see it here. Again, if I take my knees forward, you'll see how much further out the left one can go than the right. But if I turn my foot out a little bit, it actually looks like my right one comes back to what's considered normal. And so a common compensation pattern that we'll see for this ankle dorsiflexion loss is for the foot to turn out. And so if I turn my foot out and come straight down, now it looks like my knee points forward, right? But it still points to the inside of that line between the middle of my foot and my hip. And so if I go back to this position, I can't get to that position and keep my heel down. And so this is something that you can work on through therapy, and I typically stretch out every time I work out to make sure that I can do squats, lunges, step-ups during my workout without too much of an issue. But it takes me 10 to 15 minutes of stretching and moving that ankle in order to regain the motion. If you have issues with ankle mobility, it will show up in your performance on squatting, jumping, running, walking, and if it's something that you want to fix, give us a call. This is Dr. Vince signing out. Salute.